Hello everyone, I am Dr. Ajith Pillai, Chief of Cardiology at Kauvery Hospital, Radial Road, Chennai. Today we are very happy to inform that we have successfully completed a series of patients with renal denervation therapy. This is a very newly innovative technology in which patients who have refractory hypertension over a period of time which is not responding to multiple drugs can be safely cured with a very innovative way of modulating the renal nerves. We call it as RDN, otherwise known as renal denervation therapy. And this therapy today we witnessed how a patient felt after the procedure. He had remarkable control of blood pressure after the procedure. So very minimally invasive procedure, taking about 3 hours time, and this has caused a lot of change in his life. Now his blood pressure is absolutely normal, from somewhere around 200, 220 to somewhere around 120, 140. So this is, we feel very proud in helping this patient with this innovative therapy in our hospital.
So this treatment is going to give a lifelong cure for him, or it's a lifelong treatment has to be continued?
It's a one-time therapy, and the longest follow-up in the world, we have it for about 15 to 18 years. So that is a fairly long interval period. So we believe this is a one-time therapy.
So normally how patients can control BP, or how they will come to know they have got high kind of...
Sir, regular we are, like all lifestyle diseases, whether it is diabetes, hypertension or heart disease, regular health checkup is a easy way to understand. Now we have home BP monitors is easily available. During COVID time, we have all instructed or advised patients to monitor at home. So I think self-monitoring is a key here, and lifestyle measures, of course, on top of the medicines. I think lifestyle measures like exercise, prompt diet, healthy diet, and avoiding junk foods, avoiding salty foods. These are some of the very common tips we keep on telling patients. And then medicines. Now there are a lot of medicines. As I was telling earlier, we need to know which medicine for which patients. Now we have a procedure actually on top of medicines. Those patients who are not responding to medicines, now we have a procedure which can actually add on top, or even to a substantial degree substitute the number of medicines or the dosage of medicines in controlling the blood pressure of a patient.
So how this patient was treated? Because how different...
So this patient was actually, this patient had a blood pressure which was there for almost 25 years, and he was meeting different physicians. Time and again different medicines were prescribed. Sometimes it was working, sometimes it was not working. Eventually he turned out to be a refractory resistant hypertension state where blood pressure was above 220, and no medicines were actually working for him. And he was evaluated in our hospital, and he was after thorough scrutiny and after thorough imaging, we have selected this patient as usual for all of these patients who undergo this particular form of therapy. And we decided that this patient has got abnormal electrical discharges from the renal sympathetic system, and then we scanned them, mapped them detailed, and then ablated those abnormal discharges, and in a month's time the BP became normal, and for the past 1 month he is on de-escalation of medicine. That is very great of medicines, and in the near future I myself feel that his medicines will be cut to 1 or 2 or maybe no medicines at all, because I feel that he is a super responder to this procedure.
So how safe is this therapy?
So this, yes sir. So this therapy has been evolved. This is probably the 3rd or 4th generation of this particular device we are using. Somebody who has actually been involved in the first generation, we know that a lot of innovations have happened in this particular device, and finally and first of all, always safety is given prior importance. So as of now we don't encounter any complications, because I was involved in the therapy as early as 2006, so it's almost 18 years. So from that device I was using in 2006 and the device now I am using, I can see a sea change. So the current device, I can strongly say that it is very patient safe.